Hello, my name is Olivia Quimby and I'm a nursing student at the University of South Alabama. Today I will be performing hand hygiene and wet to dry dressing change. First, before I walk into the patient's room, I will verify the patient's order, I will check the hospital policy, and I will gather any items that I will need for this procedure. After entering the room, I will perform hand hygiene by using an antiseptic hand rub. And then when I greet the patient, I will first check for the patient's identity by using two identifiers. I'm going to use the medical record and I'm going to use the wristband, which is right here. So today we have Mr. Jaguar Jones. I see that his date of birth is August 25th, 1963, and that he has an allergy to penicillin. So after correctly identifying the patient, I will now explain the procedure to the patient. I will also provide privacy by closing a curtain. Then I will start the hand hygiene procedure. So for the hand hygiene, I will use soap and water. For other instances that you would use soap and water to wash your hands would be whenever you've been exposed to a spore-forming microorganism such as C. diff, whenever your hands are visibly soiled, and after using the restroom. Some instances for when you would use an antiseptic hand rub would be whenever you are entering or exiting a patient's room or moving furniture inside of the patient's room or objects in the patient's room. So before we start our hand hygiene, I'm going to remove any jewelry that I would have on. I'm going to push back sleeves if I were to have them on and push back my wrist, my watch past my wrist. I'm also going to inspect my hands and fingernails and cuticles. I'm making sure my fingernails are short and that there are no cuts, lesions, or abrasions on my hands. So now I will carefully turn on the water, being sure that it will not splash me. I will also make sure it's a warm temperature. And then I will wet my hands. I am now going to keep my hands and my forearms underneath my elbows, and I will apply 3 to 5 milliliters of antimicrobial soap. I will start to lather for 15 to 20 seconds in circular motions on my palms and the backs of my hands. I will get in between my fingers and under my nails. I will now rinse my hands. Now that they're appropriately rinsed off, I will dry my hands using 1 paper towel per hand. I will dry my hands by starting from my fingernails and swiping up to my wrist. Trying to get them as dry as possible. I'm going to discard the paper towel without dropping my hand below my waist level, because then my hands would become unsterile. Now I'm going to turn off the faucet using a paper towel. So now I'm going to begin the procedure for wet to dry dressing change. I first will position my trash can wherever I will need it for the procedure, depending on how the room is, and then I would use antiseptic hand rub after that. Then I will raise the patient's bed to a working level, depending on my height. I will lower the side rails, and then I'll make sure the patient is comfortable and help them position it anyway. So now I will put on my glasses or goggles, protective eyewear, and then I will put on my gloves. Okay, now they're all situated. Now I'm going to expose the patient by pushing back any dressing or covers or anything. I am then going to take off the ABD pad and expose the open wound and the suture line. I'm going to take off the ABD pad by peeling the tape towards the wound, being very gentle and not tearing the wound or causing any pain to the patient. And then I'm going to lift the ABD pad away from the patient where the dirty side is facing towards me. I will then assess the drainage on the dressing. I'm looking for type, amount, color, consistency, and odor. And then I will document whatever I notice or any abnormalities. Then I will take off the inner packaging. And right now I will be assessing the wound, looking for any, or noting the size of the wound and looking for the tissue type, granulations, necrotic, or slough. I will also be looking for odor of the wound. When I take out the inner dressing, I'm going to make sure not to touch around the para-wound. And then also I'm going to palpate around the para-wound on the exterior, and I'm noting for any redness, edema, or any tenderness that the patient might report. Now I'm going to discard of the dressing. In my gloves, I'm going to use glove to glove, skin to skin technique. And I'm going to angle my hands towards the trash can. Okay. Now I am going to plan my sterile field. I'm just going to move everything just around a little bit because I want to make sure I have enough room to have my sterile field and not contaminate it in any way. Now I'm going to open my sterile kit and I'm going to get out my sterile field. Then I lay it down. Okay, so now there's a 1-inch border around the sterile field that is contaminated that I am allowed to touch if I need to fix it in any way. Also, now that some of it is off the counter, that is contaminated, so it will not be sterile anymore. Also, I'm at a little bit higher than my waist, which the level of the table, and so anything below my waist would be contaminated, and so you want to keep your surface above waist level just to keep it sterile. Now I'm going to empty the stuff inside of my container, and I'm going to make sure to note not to touch the container to the sterile field and to watch out for the 1-inch border around the edge. Now I am going to pour my saline, and I'm going to note the expiration date of it, and it's not expired. I will then palm the label and unscrew the cap and then leave the cap upwards. I will pour saline into the basin, but make sure that I do not have any splashes to my sterile field or that the containers don't touch. Okay. Screw the cap back on, and I'll put it to the side. So now I'm going to don my sterile gloves. Okay, I'm going to touch the inside of the tabs, making sure I don't contaminate. And I'll touch the 1-inch border on either side. I'm going to touch the inside of the lip. That will be touching my skin. And then I'll take 2 fingers and then keep my thumb up to help apply the other side. Now I can fix anything wrong since both my gloves are sterile. Okay, I'm good to go. Now I will organize my contents on my sterile field now that my hands are sterile. Move this over here. Okay. I'm going to soak some 4x4 gauze in the saline solution. I'm going to soak 5. 1, 2, 3, 4, 5. Okay. Now I am going to assess the suture line. I am noting for the size of the line, the approximation of the edges, the drainage, and also any other abnormalities. And if I see anything, I will note it. But now I'm going to clean the wound, the suture line. I'm going to take a 4x4 gauze in the saline solution, I'm gonna squeeze it out and then make it to where my fingers will not be touching the patient's skin at all. I'm going to then be wiping the incision line in the center of the incision, but wiping from least contaminated to most contaminated. I will go in the center, just do one swipe, and then I will discharge above my waist. I will then repeat this process 2 more times, one on each side of the central suture line. So next I will do the right side, from least contaminated to most contaminated, and throw it in the trash. Then I'm gonna squeeze it out again. And then again for the left side. And then okay, so now I'm going to pat dry the incision line with a dry gauze. I'm going to do the same type procedure. Keep my fingers from touching the patient, and I'm going to do one swipe or one pat, one line down where I'm going to pat the incision line, and then I will throw it in the trash. Okay, now I'm going to pack the open wound. So I'm going to take some of the 4x4s in the saline solution. I'm going to squeeze out any of the excess fluid, and then I'm going to open this 4x4 up really well to fluff it. We do this so it'll fit loosely in the wound. Okay, and then so I'm just going to put it in the wound without touching anywhere around the parawound edge. I'm going to do it one more time. Trying to fluff some more. And then place it in there as well. So now I will take a dry 4x4 and place it over the top of the wound. And then now I will take the ABD pad and place it on top of the open wound with the blue line up. So now I have finished the sterile procedure. I'm going to doff my sterile gloves. I will be using the glove-to-glove, skin-to-skin technique. So, and I'm just gonna discard them in the trash. Okay, so now I will use my tape, and I'm gonna tape the perimeter of the ABD pad. Here we go. Normally I would put a piece of tape on top of the exterior of the ABD pad, where I would initial, date, and time the last dressing change that I did. So the next nurse, whenever he or she comes in, will be able to know how recent the last dressing change was. Last side. Okay. So now I will reposition the patient to making sure that they are comfortable. I will lower the bed all the way down to the floor as low as it can go, and I will raise the side rails up the side of the bed. Then I will perform hand hygiene and then discard all of the equipment that I used today. I will also document the open wound and the incision line, and then how well the patient tolerated the procedure. And that concludes this checkoff. Thank you.